Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Sarah, welcome to the show.
Hi, thanks so much for having me.
Yeah, absolutely. I usually open up my episodes by saying I'm so excited to have you, and I am super duper excited to have you, but I have to be honest, I'm a little nervous to have this conversation. Before we started recording, I was sharing with you that loss is not anything I have ever shared about before, and it is because honestly, I was scared. I was scared that I didn't know what to say. I didn't know how to present it. I didn't know where I would even start. And so I just didn't do it. And for that, I really do want to say I'm very sorry. I let my own fear stop me from bringing you guys the information that you wanted. And so here we are. We're having this conversation. This is very much a learning experience for me. I don't know very much about this topic. And what I have learned is very shallow. And so I'm excited to dive into that with you today. I also think that we all know the stats on infertility. We all know the stats on loss. And maybe we don't. We can start there. But everybody knows somebody who has experienced something in the realm of pregnancy loss or fetal loss. And it's out there. It's common. And I think everyone listening can take something away from today's episode, whether that is, oh my gosh, I'm normal because I'm feeling these things after a loss, or, oh my goodness, I know so many people who have experienced this and I could have been better. I could have known what to say. Next time I'm going to know what to say. So, Sarah, truly, thank you so much for being here with us today. I'm excited to dive in, but before we dive too deep, can we start with maybe those rough numbers of infertility and loss? And how are we defining loss when we think about early loss versus stillbirth, things like that?
Yeah, that's a good question. Okay, so let's start with infertility and the stats of infertility. The official statistic is that 1 in 8 couples struggles with infertility, but that statistic only covers couples who are have gone to a doctor and said, "We're struggling, and can you help this?" So I don't actually fit into that stat, even though I did struggle to get pregnant because I did not go to a doctor for medical assistance in getting pregnant. So the guess is that it might even be up to 1 in 4 couples that
Yeah.
struggle to get pregnant. And that definition would be couples who have been trying for over a year without a pregnancy or without a viable living baby pregnancy. Then miscarriage, the stat on pregnancy loss is 1 in 4. That's the official statistic. But that statistic hasn't been updated since I think it was 2018. And every medical professional that I've talked to since COVID has said that statistic might be up to 4 in 5 pregnancies
Wow.
end in loss. And that includes super early losses that the baby died before you even knew that you were pregnant. And that includes full term stillbirth losses. So it's a whole broad spectrum, but just COVID in general definitely upped the number on that. And there hasn't been any official statistics coming out on the official numbers of that yet. So it's a lot.
Yeah, but regardless, it is a really high number of people experience some sort of loss in some way, form, or fashion. And I think normalizing things is really important, but also knowing how to support those people along the lines of normalizing things. On your Instagram, you talk about, tell people about your loss. You don't have to hide it. Can you talk to us about that? I am coming from a place that I've never experienced loss, but I have never also tried to have a baby. I'm not to that place in my life yet. And so I don't know what that would be like. Help our listeners understand why someone might want to hide a loss.
Yeah, there's still, especially with early loss, there's a lot of stigma around it that, oh, that's shameful, you shouldn't share that. And I felt that a little bit. I have super supportive friends, super supportive family, but my loss was a missed miscarriage. And so my baby died, but my body didn't know that for 5 more weeks. So my baby wasn't like passed away probably around 10 or 5 weeks, and I didn't deliver until 10. So somewhere in the middle there, we found out that there was no heartbeat, and we chose to wait to let my body deliver naturally. That's a whole nother side of the story. But in the middle there, while I was still technically pregnant with a dead baby, we decided to tell people, hey, we're experiencing a miscarriage and we need support. And no one told me you shouldn't talk about this.
Hmm.
But a lot of moms, a lot of women, even women my grandmother's age, messaged me to say, hey, I experienced a loss too, and I've never shared with anyone.
Wow.
To. Like, I had probably 10 or 15 people, and this was before I had an online presence talking about loss. This was just on my personal Facebook of people saying, hey, I experienced a miscarriage too. My baby would be 17 years old, and I've never told anyone,
Oh my goodness.
because it was just, for such a long time, it's been a taboo topic. And our generation, I'm 28, so my generation is full of people who are like, hey, let's destigmatize mental health. Let's destigmatize all of these different things that we struggle with. And along with that comes, let's destigmatize miscarriage. And so there's a lot more people talking about it, but that hasn't historically been the norm. So
How come? What is the shame around it? Is it shame that your body didn't work? Shame that you're going to scare other women? What is I don't know,
I
the
think it's,
reasoning?
I don't know. I think it's a little bit of both. That there, I think every single person I've talked to that lost a baby, and there's thousands of those women at this point
Yeah.
too, have said at some point they were ashamed of their bodies and
Oh,
they felt guilty, as if it was something that they could prevent or something that they did that caused this. Or they just don't trust their bodies anymore because their body didn't do what it was made to do. And
sure.
especially, I'm a Christian. I grew up in a Christian world. We're told all of the time, like, as a girl, your end goal is to get married and have kids. And and even if you didn't grow up Christian, that is prevalent in most of the world. That, like, it's such a, and it is a wonderful thing to grow up, get married, and have kids. I'm not saying that it's not. But when you feel like your body failed at that goal, it's shameful in one sense, because
Hmm.
it's okay, if my goal is to grow up and have kids, get married and have kids, and I can't have kids, then that hurts a lot. And sometimes it's just the pain that keeps us from talking about it. And
Hmm.
sometimes it's that I feel ashamed that I couldn't accomplish this goal that keeps me
Yeah,
from talking. So
that's really hard. Okay. That's tough. But knowing that there are a lot of people out there is like a double-edged sword, right? It's horrible that there's that many people out there, but it's also comforting. All right, I'm not alone in this horrible thing. Not that it makes it better that other people experience this horrible thing with me, but I don't have to do it by myself.
yeah.
What else, other than that shame and guilt that you just mentioned, might someone feel after any sort of loss? For me, I think anger would be
Yeah. Anger is a
predominant.
big one. Yeah.
Yeah.
You're angry at yourself. You're angry at God. You're
Mm.
angry at medical professionals who didn't catch something. There's so many different things that you could be angry at. And that's a totally normal, like, it's a normal trauma response in one sense, and it's a normal grief response. So yeah, anger. I'm trying to think of grief, just no matter how early your loss is, that was a baby. And so many moms experience heavy grief. Some experience even depression. Like, it's funny to me that it's considered postpartum depression. Even with an early miscarriage, if you experience depression within that first year, it's considered postpartum depression because there's the hormone shifts that would normally come with any postpartum. Even if your pregnancy ended at 8 weeks, you still have that hormonal shift. You still have all the changes that happen postpartum. So the depression and grief that come with loss is considered like a subset of postpartum depression. But it doesn't get treated that way because you don't have a living baby to say, hey, I'm experiencing postpartum depression. So that's also complicated.
Wow. Oh my gosh. Can we dive more into that? It's not surprising. I feel like all things postpartum are forgotten. I feel especially loss, the community is just so underserved. So you stack those two on top of each other. Yeah, no kidding. We don't serve that. What can someone expect from that experience? What's the typical route, and what might somebody need to ask their provider to get some different
Yeah.
care?
If you've had, I guess the definition of miscarriage and where that switches over to stillbirth is really blurry. So, depending on who you ask, that can be anywhere from 16 to 24 weeks, um, which also makes it difficult. But if you've had an earlier loss, or if your provider considers it an earlier loss, you might not even have a postpartum checkup appointment. I gave birth at 10 weeks, and I did have a postpartum checkup appointment, but it was because I asked for it. And they did an internal vaginal exam to make sure that I didn't have any tissue left. And that was it. They didn't really ask me about my mental state. They didn't really, like, that was it. And I know a lot of moms, that's the story for them, that even if they do have some kind of a postpartum appointment after loss, they aren't asked how they're doing. Or if they are asked how they're doing, it's just, oh, you lost a baby and you're grieving. Of course you feel like that. And they never really take a close look into what really is going on mentally for that mom. And then if you had a later loss, they require like the 6 week checkup, just like they would for a living baby, which is good because there are physical things that can happen in those 6 weeks. And a lot of those moms do get like the general postpartum screening that every mom gets at the pediatrician's office or at their OB. But again, that's a lot of times that's it. And it's not, hey, you just lost a baby and that's a really hard thing. Can we talk about your mental health? It's just, you gave birth and you're postpartum, go home.
Oh
And
no.
a lot of moms go in after stillbirth and they don't even, like, the nurses don't even check to see whether their baby lived or not. And so they come in and they're like, oh, how's your newborn baby? And you're like, my baby died. And that can add whole new levels and layers of trauma. I know so many moms, that's their story, that they went in, nobody checked their chart, and they were asked about their baby when they were there for a 6 week postpartum checkup.
Oh my gosh. I'm literally crying. That hurts my heart so badly for these people.
It's, yeah, it's awful. And what does it take? 2 minutes to check somebody's chart?
Seriously. Oh my gosh. And that will make or break someone's visit with you, right? Oh
And
my
that's not to say that
goodness.
every provider is like that, because there's so many providers who are amazing, who do check up on their patients and know their patients' stories. And those doctors and midwives are wonderful, amazing, fantastic people, but they seem to be the minority from
Yeah.
what I'm hearing from moms. So,
Oh my goodness. Okay, so can you step us through if there are any medical professionals listening and they're like, okay, so I check the chart, then I enter that room. Now, what do I say? What is someone in the shoes of someone who has just had, and if it's different for early loss versus late loss, would you mind stepping us through both so that we could maybe equip our medical professionals with the words that would be comforting to these families?
yeah, no matter when, you can always say, hey, I am so sorry for your loss. Start off with that. Let them acknowledge that, and acknowledge that's a hard, rough thing. I'm so sorry for your loss. How are you doing? and don't let them get away with, I'm okay, because
They're
that's
not.
to be everybody's answer and they're not.
Yeah.
So say no. How are you really doing? Is grief hitting you hard? And then, of course, ask them about their physical well being too. Are you still bleeding? And has that slowed down at all? Like those questions need to be asked. But ask them, are you eating? Are you sleeping at night? Those kinds of things, because like grief presents in so many different ways. And the way that you take care of yourself after grieving or during grief will affect your mental health going forward. So ask them the questions. Remember that they're real people and don't treat them like a number, I guess is really what I'm saying. And then it's always good to say, check their chart. And if they named their baby and if their baby's name is on their chart, use their baby's name.
Hmm.
If their baby's name isn't on their chart, ask them, hey, did you name your baby? Because I would love to acknowledge the humanity of your child. My baby, his name is Peanut because that's what we called him all during pregnancy and it just stuck after. And my midwife used Peanut's name during my rainbow baby's birth and pregnancy and birth. And ask, hey, does your baby have a name? Because I want to remember your baby with you. That means the world to a mom to hear her baby's name. Even moms of living babies love their babies' names and we love to hear them. And my rainbow baby's name is Josiah, and I love the name Josiah. And so we love to hear names, and it humanizes it to use a name. And it says, hey, you're more than just a number to me, to use a name. So,
Yeah.
and
Okay.
then don't say at least. If your sentence starts with at least, just cut it out. Like,
Just zip it back up in there.
but don't say something like, at least your loss was so early, or at least we caught it before you actually gave birth so that we could prepare you for birth, or at least you know you can get pregnant, or at least you have living babies at home, or like all of those things just diminish the mom's experience
Hmm.
and they add an extra layer of grief and trauma and they don't help. So don't say at least
Yeah.
for anything.
Okay, so what are some other helpful things versus not helpful things to say and not say?
I'm trying to think. A lot of moms don't love the term loss. And I am neutral on that one. I don't mind that somebody calls it a pregnancy loss, but a lot of moms, to them, it just takes away the humanity of their baby by diminishing them to a pregnancy that was lost. And so if you can say something along the lines of, I'm sorry that your baby died. Like, we know our baby died. It's okay to say that.
Wow. I don't know. I don't know that I would ever say that.
And
I just
again, it's
don't
something like
know.
you need to know the mom that you're talking to because some moms are going to be slightly offended by that. Some moms are going to say, hey, yeah, my baby did die, and thanks for acknowledging that. So if you don't know, then just don't say either. If you don't know,
Mm-hmm.
some moms are really blunt and they want you to be blunt. And some women are like beat around the bush women anyway. And so it's okay to say loss. And that's where if you're a friend of a mom, you need to know your friend and
Mm-hmm.
know the type of person that they are. And also it's 100% okay to say, hey, I'm not sure how to talk about this.
Yeah.
Can you help me to love you in the way that I talk about this with you?
Oh my goodness. I don't know why I don't know. This just gets me. I think I feel so sad for the people who had to do this alone and they didn't have anybody that said that to them. It just makes me feel so sad for them. I think there's a piece of me too that knows I didn't know how to support people like this in the past, and I probably could have been a better friend to the people in my immediate circle.
Yeah.
Yeah.
I after our loss, I did have to go back to some moms and say, hey, I probably caused you more grief in the way that I handled your loss. And I'm sorry for that. And they, all of them were so gracious and so
Yeah.
kind. But you don't know what you don't know. And so it's also okay to go back to someone and say, hey, I'm really sorry for the way that I handled your loss. And I
Yeah.
didn't know better. And I'm learning. And I apologize.
Yeah. For sure. Okay, what kind of support is out there for people who have had losses? So, if you are a friend of somebody who has had a loss, or you're a medical professional and you're trying to get this family some support, mental health counseling, obviously. Anything additional out there?
Yeah, there's a lot. And I'm trying to think just as we're talking off the top of my head. So if you are approaching loss, let's say, like in my case, you're having a miscarriage, or you have a diagnosis, a life limiting diagnosis, or something like that, that you're looking ahead and saying, my baby either already died or is going to die, but I haven't delivered yet. Look up a company called Still Birthday. It's all one word, like stillbirth and birthday pushed together. Still Birthday. They certify bereavement doulas, and they literally have people internationally who are doulas, so they understand birth, but they're bereavement doulas, so they understand the loss of a baby. And I certified with Still Birthday, so they're my favorite. But they are, yeah. And also on their website, they have pictures of babies born at every gestation, so that you can go on and say, hey, my baby died at seven, or is dying at 17 weeks. Go on and see a picture of a 17-week baby, so that you know what to expect. Because a 17-week baby doesn't look the same as a 24-week baby, and that doesn't look the same as a 40-week baby. They all look a little bit different because they're at different stages of development. And so preparing yourself for what you're going to be seeing can be really helpful too.
Wow, I never
That's
even
all
thought about
Still
that.
Birthday.
Yeah. Okay. Any other resources?
Yeah, I'm going to blank on the name of the company, but they do what they call timely tender totes. And
Okay.
so if a mom who had a stillbirth, they will send, or really any loss, they will send a tote full of all kinds of goodies, and it includes books and resources in that timely tender tote to be able to support a mom through and after a loss. There's so many. There's um, Hope Mommies International. There's Gathering Hope. There's Miscarriage Hope Desk. There's me. I'm the pal doula. There's, I don't know, there's so many. The Cuddle Cub, I think is what it's called. They send you a teddy bear that is weight sized and weighted to be the same weight as your baby, so that you have something that weight to be able to hold and get comfort from. I'm pretty sure that's called the Comfort Cub. Yeah, those are all comforting resources after loss. I'm trying to think of others. There's literally so many. Just get on Instagram and search Lost Mom or Bereaved Mom or Angel Mom. Those hashtags will bring up dozens and dozens of accounts.
Okay. Yeah, to find your community there.
Yeah. And there's someone for everyone. I'm a pro life doula, and so I reach people that, like, the TFMR community might not be comfortable in my space, and that's okay. But someone who is pro life might not be comfortable in the TFMR space, and that's okay too. Um, so there really is someone for everyone on Instagram. There's a huge
Yeah.
community of who have babies who are not here, and yeah, they will make space for you.
That is both comforting to know and also very sad that all of those communities exist. Can you explain what TFMR is and if these same feelings and the same kind of ideas that we've been talking about apply to that community?
Yes, so TFMR stands for termination for medical reasons. And those are moms who their babies had a diagnosis, and it's usually presented as a life limiting diagnosis or a fatal diagnosis. Those are the words that are used, but where they either have to end the pregnancy to save their own lives, or where they end the pregnancy in order to prevent further suffering to their baby, those kinds of things. So, and there's a huge community of them, and I'm currently in trouble with them on Instagram because I said some pro life things and apparently alienated them without even trying to. And so, if you come from that community, I'm sorry for that. But yeah, so there's a huge community of them, and TFMR moms go through a lot of the same. They're grieving a baby because they loved that baby. Um, and there is a lot of shame in that community, even more so because they went through an abortion, and there's shame attached to the word abortion and a stigma attached to that as well. And I can understand that completely. I think a lot of them end up struggling almost even more with the shame than some moms that that their babies died naturally. Yeah. And there's tons of resources for them too. The TFMR psychologist, and there are others. I can't remember all of them right now, but I can email more for you to put in the show notes.
Yeah.
But yeah, that community support just like all the rest of us do.
Yeah, absolutely. One thing I've learned to be true in life is that everything is actually on a spectrum. Nothing is ever black and white. There's always gray. It's just always a spectrum. And you just have to decide where you land on that spectrum and then find your people.
And I
So,
am not the right person for every single one.
yeah,
A full term stillbirth might not be comfortable coming to me because I didn't. Um, Someone who had a miscarriage but chose a DNC instead of going the natural route might not be comfortable coming to me because I almost naturally delivered my miscarried baby. I ended up having to go to the emergency room and have a DNC last minute, but that's a whole other story too. Or someone who had multiple losses, recurrent pregnancy loss, might not be comfortable coming to me because I only had one. So I'm not the right person for everyone, but I know that there are resources for everyone out there.
yeah, that's very comforting to know. Okay, I'm wondering, I think probably the question that's on everyone's mind is we've learned we should talk about this. We know that just because it makes us uncomfortable as the support people to bring this up, we shouldn't shy away from these conversations. We should use their babies' names. Can you give us a couple of ways that we might be able to do this and check in on our friends and how we might be able to gently bring this up in conversation without being awkward? Or maybe it's just going to be awkward regardless, and that's just part of being a good friend.
Yeah. It's going to be awkward regardless, and that's part of it.
Okay.
But
Yeah.
I mean, treat that mom like any other postpartum mom. Bring her meals, clean her house, because the mental load of grief is so heavy in those early days that it feels impossible to get out of bed and take a shower, much less to create a nutritious meal or to work out or to clean your house. Treat them postpartum because they are, and do everything that you would for a postpartum mom with a living baby. Do the same thing for your postpartum mom whose baby is not here. Yeah, that would be my top recommendation. As far as like other tangible things, come in, say I'm really sorry, and I'm here to listen if you want to tell someone your story. I had several women do that, and none of them actually experienced loss before, but they were willing to be a listening ear for me. I'm gonna cry. These
Absolutely.
are so special to me because they made themselves uncomfortable in order to show me that they loved me. Um,
Totally.
One took me out for coffee and was like, "Hey, tell me your whole story if you're comfortable with doing that, and I'm here to listen." One brought a meal over, and she couldn't even get words out. She just started crying and gave me a hug, and then she sat on the floor and just cried with me. And we didn't say anything to each other. We just sat and cried. And that was so kind.
Yeah.
Another of those women, she did lose a baby. Her firstborn baby would have actually been the same age as me, and her second baby is about 6 months younger than me and is one of my best friends.
Oh
Um,
my goodness.
so Sherry brought, she was a nurse, so she happened to be on shift right after our miscarriage while I was still in the ER. And she came and found me in the hospital and cried with me and prayed with me. And she was like, "Hey, I've experienced this too. If you need someone to talk to, I'm right here." And then she's good friends with my mom. And I live in North Carolina. My parents lived out west in Arizona at the time. And she contacted my mom to grieve with my mom, and then my mom sent Sherry a care package so that Sherry could package it all up for me and deliver it in a pretty way for me. So Sherry acted as that in between for my mom because my mom couldn't be here, be present here, even though she desperately wanted to be. But, and some moms who have babies not here, their relationships with their own mothers are complicated. And so if you're at that age, that much older than them, it might be so helpful for them to just have a mom figure to come in and love them and be what a mom would be for them. Those are some things that I can think of off the top of my head. There is there are several creators who make like miscarriage jewelry. Peak Valley Designs is one that's coming up in my head, and Little Santee Designs. They both do like miscarriage remembrance jewelry. And then there are artists who create wall art of your family and add your baby into it. We just bought one of those pieces for a friend who had a miscarriage last year and gave it to them for Mother's Day. And little things that say, hey, I remember your baby, and I know that you remember your baby because a mom never forgets.
Yeah.
And I'm going to love you in a tangible way.
I think that's really easy to do. One of the things that I've learned from lost moms or moms that don't have a baby here physically is a lot of times they will have something that represents their baby. For me, I just remember so distinctly her face and what she was wearing and her voice. I can literally hear her telling me that her daughter is represented by yellow butterflies. And now every single time I see a yellow butterfly, I'm like, oh my gosh, I remember her.
And
Butterflies.
that's you. But if you see that yellow butterfly, reach out to that mama and say, hey, I thought about your baby today.
Yeah.
Because it means the world to us to hear somebody remembers our baby even years later. Peanut, it would be 3 if he had lived, and people still reach out to me and go, hey, I saw something today that made me think of your baby, and I love that. It's encouraging to hear that he's not forgotten, even if it has been 3 years and I'm the only person who ever met him.
That's really special. I think that is a place where a lot of us can get out of our comfort zone very easily and make that our first step is just to remind people, hey, I haven't forgotten your baby. I remember them. They crossed my mind. That's
We have
special.
a good friend who I posted on Peanut's third birthday about how I like to imagine if Peanut was alive, what would be the theme of his birthday this year. And
Yeah.
my imaginings for his third birthday was dinosaurs. And I had a friend who, for my rainbow baby's first birthday, gave him a dinosaur coloring book. And she was like, I actually bought this right after you said that Peanut's birthday would have been dinosaurs. And so I bought it and I thought Josiah would love it and whatever. And it was just like the sweetest, like helping my children, like,
Have a connection.
I guess.
Yeah. Have a relationship.
Yeah.
That's amazing. Will you talk about Peanut with Josiah as he grows up? Will you incorporate this into your family's story?
Yes. Yeah, we definitely do. Josiah is 15 months, so he doesn't understand a lot yet. But
Sure.
on Peanut's birthday, we celebrated with Josiah. We got a big cupcake and a candle, and we sang happy birthday to Peanut. And we told Josiah, hey, you're not our first baby. You might be
Mm,
our oldest baby, but you're
yeah.
not the first one. And you have a sibling in heaven. I'm convinced Peanut was a boy. I don't know for sure, but you have a sibling in heaven that mommy and daddy love and that we want to talk to you about. And we have on our wall back there on that side, there's my mom made 2 cross stitches when Josiah was born, and one has Josiah's name and his birthday, and the other one has Peanut's name and his birthday. And so Peanut's part of our house and part of our family. And my husband and I talk about Peanut all the time. And Josiah is growing up hearing about Peanut, even if he doesn't completely understand at this point.
Yeah. Not yet, but he will. Okay, I have a question about pregnancy after loss because I think that pregnancy is a really exciting time and it's also a scary time for everyone, even if it's your first time being pregnant. But after you've experienced a loss, there are these what I call tag along emotions where they didn't originate here in this pregnancy, but they're definitely here from past experiences. What can someone expect with a pregnancy after loss?
Yeah, that's a really good question. I think the first thing that I didn't expect, but came up for me, and I know comes up for so many moms that I work with, is that your grief gets deeper. We a lot of times think, oh, if I get pregnant again after loss, that will help heal me, and that will at least put a band-aid on this horrible wound of loss, and it will start the process of getting better. But for a lot of moms, another pregnancy opens the wound of grief even more. And you find yourself grieving the baby that was gone and wishing that they were here to experience this new pregnancy, or wishing that, honestly, a lot of moms even wish that baby was here instead of the baby that they're pregnant with. And, and that it's not like they recognize that they want both babies, but it's a natural part of just part of
Grief.
grief and processing and trauma and all of that. And then there comes with that, there's guilt going, I'm still grieving that baby, even though I have another one on the way. And does that make me a bad mom? Do I not love this baby who's coming? Or if I'm excited about this baby who's coming, does that mean that I don't love the baby that I don't have? And it's just this complicated web of grief and guilt and anxiety and fear and shame, and but also excitement and joy and love. And it's so complicated, and it's really hard to sort out those emotions sometimes. And then you have grief. I said grief, I said guilt. Then you have anxiety. And I've had a little bit of backlash recently because I've said that the anxiety of pregnancy after loss is different than clinical anxiety. And some people are saying I can't even call it anxiety during pregnancy after loss because it's not clinical anxiety and I need to just call it fear. But it's so much more than just fear. Like there are
Totally.
physical representations of that anxiety as well as mental. It's anxiety. It's like saying that gestational diabetes isn't diabetes.
Like it still is. I'm just
It is
pregnant for it.
anxiety, even if it's not clinically diagnosed.
Yeah.
Yeah. But that anxiety, your mind is full of what if this baby dies, or what if this baby lives but they have some special need or some diagnosis or something. What if this baby dies and that means that something is broken with me? And then I'm going to just talk to dads for just a second. With a pregnancy after loss, there's the fear of losing another baby but also losing your partner, because I think that's another trauma thing, is that once you've lost one family member, you're terrified of losing another. And so my husband struggled a lot with being afraid that I would die during my whole pregnancy. And that was a big fear of his because we lost a baby before. There was always the potential of losing another baby. And he was so afraid of losing me on top of all of that. So there's complicated fears, and it's not, you can't just say I'm scared, because there's a whole lot of layers to that fear. Does that make sense?
Yeah, absolutely. For sure. For both people. And it's going to be different for men and women. So, what should couples be doing and engaging in? What kind of conversations should they be having? Do you think therapy is just like a generally a good idea? If you're experiencing these types of things, we should definitely be in therapy. What should couples be thinking about if they've experienced loss? And let us know if it's different with early loss versus late loss.
I it's hard to even put one umbrella, this is what you should do, because every couple is different, every baby is different. You know this, we talk about how every baby and every birth is different, because it is. That applies to loss too, because again, it's a baby, it's a mom, it's a dad, it's a birth. And so pregnancy after loss is the same way, that it's a baby, it's a mom, it's a dad, there's a sibling. I mean, and it that every pregnancy, every baby is different. So it's hard to say these are the things that you should do, because every single family is different and every single pregnancy is different. And no two pregnancies after loss are the same. So for me, pregnancy after miscarriage was really difficult. Somebody else would say pregnancy after miscarriage was not that bad because miscarriage happened early, and once they got past that gestation, they were fine. That's not me. And I've had other people say, you don't understand the anxiety because you didn't have a full term stillbirth like I did. And in one sense, they're right. I don't understand their anxiety because I'm not them. But it's not because of the gestation in which my baby died, it's because I'm not them. So a 41-week stillbirth, that mom pregnant after loss will have completely different emotions and feelings and thoughts than another 41-week stillbirth pregnancy after loss. And then a 10-week miscarriage with another 10-week, they're all different. You can't compare the two. So going from there, therapy might be a good idea for a couple. My husband and I didn't feel like we needed that because we had an incredible support system around us. And we just happened to go to a church that has several certified biblical counselors. So they're not psychologists, but they're counselors. And so we felt like we could go to them because they were our friends. And that's not like formal sit down in their office, have a therapy session, but we could go to them and ask questions, and we could ask them to pray for us. And we knew that they would. But somebody who doesn't have the same kind of village that my husband and I had might need to make their own village and to have a therapist or a doula who understands loss and pregnancy after loss or that kind of thing. It's important to find a provider who understands. Sometimes it is because you're like, they know my whole story. But sometimes it's not because they handled my story in a way that I didn't love or that kind of thing. So having that conversation with your partner is important. Yeah, we had conversations about I wanted a home birth, and my husband was a little bit afraid of a home birth because we knew about loss. And so it was a conversation that we had of what are we going to decide is safe for us and who are we going to trust. And we found a midwife that we trust because her brother is my dad's best friend. So we had connection with her already, and we could both trust her better than the OBs around us. We could trust her better than the other midwives around us because we already had a relationship with her. But having that kind of conversation with your partner of who are you going to trust? Who are we going to trust with our baby, with ourselves? And it might be worth it to shop around. We drove an hour and a half away for our midwife and delivered in a different state for our
Wow.
midwife. But we knew we could trust her.
Yeah.
And so that kind of conversation needs to happen of who can we trust? Where are we going to feel the safest? And it's important for both mom and dad to feel safe during a pregnancy after loss because you know that you're not safe. Once you go through a loss, it's come up so many times with moms that I've talked to that pregnancy is not a guarantee anymore once you go through loss and you don't feel safe anymore. So to find as much that you possibly can to feel safe is going to be important for you. I don't know if that makes sense.
Yeah, absolutely. It's just so crucial to find a provider that understands you and understands your goals and understands your trauma and your past and, where you're headed and your story so that they can best support you along that journey. Absolutely. That makes so much sense.
And I'm not going to say that what worked for me is going to be like the band-aid for everybody else because again, I'm different from everybody else. I just did a couple episodes on my podcast with Push Pregnancy, and they're working with some providers in, I think, in California and New York. I have to go back and listen, but who are creating what they're calling rainbow clinics.
Yeah.
It's home medical offices dedicated to pregnancy after loss, where you can get specialized care for pregnancy after loss that some moms might find super necessary just because, hey, these are people that I don't have to fight for my rights with because they'll understand where I'm coming from. Does that make sense?
Yeah,
So
absolutely. Part of our team attended a symposium that the New York Rainbow Clinic put on. We're based in Boston, and so we're quite close. It was just a train ride away. And we went, and it was fascinating to hear the data and the research and what they're implementing and how they're supporting these families. It really, again, our team doesn't do this very often. We don't really know. We're just now dipping our toes into the waters of loss. And so it was really pivotal for us. It was a great symposium. Yeah, for sure.
another conversation between partners needs to be what's going to be triggering for us and how are we going to handle those triggers. So like for my husband and I, he had to tell me that I could not call for him from the bathroom. That would be a trigger for him because that was where our miscarriage started. I yelled at him from the bathroom, and so it was so triggering for him. So I am not allowed to yell at him from the bathroom. And so that's just a little thing. And then I knew that bleeding would be triggering for me, and I know that's the case for almost every lost mom I've ever talked to, that bleeding is a huge trigger. So talk about, like, for me, when I did go into labor with my rainbow baby, I had the bloody show and the bloody mucus, And it was so triggering for me. And I just about had a panic attack. And my husband was like, hey, we talked about this. Remember that this is a normal part of labor. This is a normal part of birth, that you are safe and the baby is safe and your body is doing what it's supposed to do. And we had to talk through that. But he knew that was going to be a trigger for me beforehand because we talked about it. And there might be other triggers that you might have to paint the walls in your bathroom a different color, or you might have to not have white sheets on your bed your whole pregnancy. There's so many different things that are so individual to each family that you might have to just talk through, figure out what you think is going to make your brain remind your brain that you're safe.
Yeah.
And get rid of things that make your brain think you're not safe.
Yeah. I'm thinking about boundaries with people in your life. So mothers, mother-in-laws, siblings, people at work, your friends, your friend groups of things that are not helpful to say or that put fear in you versus things that remind you that you're safe. That
I
would be
did have
helpful.
to tell some people, please don't say anything about, we know that this is the baby that's going to make it, because we don't know that. I didn't know that. And it tore me up emotionally when someone said that to me. And I had to be like, hey, please don't say that. That's just not helpful. And they were gracious to take my advice and my request. But those kinds of things too, just, yeah, there you might have to put up a boundary with someone, and it's okay to do that.
Yeah. I think most of us can agree that almost everyone comes to the table wanting to say the right thing and like wanting to bring you comfort and wanting to be kind about the situation. But death is very uncomfortable for many of us. And so a lot of us don't know what to say. We end up saying the wrong thing.
Yep,
Yeah,
100%.
definitely.
And then it might also be important. I know we just talked about after a loss going on Instagram and finding your whole community on Instagram or Facebook or wherever your social media is. But when you're pregnant after a loss and you've built your social media around loss,
Mm,
that can be really heavy for your mental health. And it might be necessary to take a step back from social media or just to like completely delete it when you're pregnant, because you've already curated your feed to be lost families and lost stories and pictures of babies who have passed away and that kind of thing. And that will only add, I call it awareness fatigue, of you're aware what can happen, and that just adds to your fear.
like almost too aware.
Yeah, yeah. And so you need to, it might be super important for you to step away from that and remove yourself from that in order to protect your mental health while you're pregnant again.
Yeah. Yeah. Wow. Okay.
And lots of people
Boundaries.
understand that. If you say, hey, I'm taking a step away because I'm pregnant again and I need to protect my mental health, they all understand that. They all support you in that. A lot of us have been there too, and we get it. And if you need that community again, they will all be there for you when you come back.
Yeah. It reminds me of people who text or message me on Instagram and say, "Hey, I'm having to unfollow you because I had a loss and I will be back when I get pregnant because I want to come back to your community, but right now it's too hurtful." And I'm always like, "Oh my God, you do you. I'll be here when you get back and I'll
Yeah.
catch up on everything you missed, and it's totally not a problem. You need to take care of yourself." Very similar things for sure. Boundaries are just like so important. They are just so important. It's how you
I,
keep yourself safe.
I think I grew up with this idea of boundaries being a bad thing because it
Yeah.
to other people sometimes, but boundaries really are a neutral thing, and it's on the other person whether they're hurt by your boundaries or not.
Yeah, absolutely. I think everyone's on a different path to healing with boundaries, with both setting them and respecting them and learning how to communicate them, learning how to set and hold them. I think a lot of people, I'm 33, so a lot of people in our generation especially are doing the work to do that because we didn't all necessarily grow up in a house that did that work with us or for us growing up.
Moms all the time, you are not responsible for someone else's response.
Yeah.
So a lot of lost moms, when they get pregnant again, they're afraid to even announce their pregnancy after
Mm,
loss because they don't want to hurt other lost moms. And I totally understand that. And if you have been through loss before, chances are you've been hurt by a pregnancy announcement. That's just
totally.
the nature of grief. But I tell them you're not responsible for their response. And it's okay to announce your pregnancy. You can put a disclaimer about, hey, I've been through a loss and I understand if you're grieving loss and I understand if you need to unfollow me. But then leave it at that and choose to celebrate your baby and don't worry about their responses because that's on them. And the same thing goes with boundaries. If you put up a boundary, that's what you need to do for your safety and your mental health and for your baby. And you're not responsible for someone else's response to that boundary. So,
Yeah. Boundaries are hard. They're hard to navigate, they're hard to hold, but they are essential for our safety and our happiness for sure. Yeah. Sarah, this has been such a good conversation.
I
Is
could
there
probably talk about this for years, honestly.
Yeah. I am wondering if there's anything that we've left out of this conversation that you want to tackle right here at the end, or does this feel like a good kind of starter pack for people? Actually, before we wrap up, maybe you could step us through a text message or a phone call that we could send to our best friend who's been struggling with infertility and we got pregnant. How do we tell them before we announce it to the world? Or our
Yeah.
sister or someone close to us.
I am really glad that you asked that question because it's important. But also, I'm glad that you asked about a text because in most moms that I've talked to would prefer to receive a text or even an email rather than a phone call or a face-to-face conversation because that gives us a chance to process in private and to
It's
cry
just
in
too
private.
hard to get that in person. Totally.
You can write something like, "Hi, friends. I just wanted to let you know via text that I am pregnant again. And I know that can be a triggering, difficult thing for you. And I want you to know that I love you and that I remember your baby who's not here and that I still support you. I hope that you can celebrate and participate in our joy, but I totally understand if you can't. And I just want you to know that I'm here for you." Something like that. And then along with that, you can say almost the same thing if and when you invite them to a baby shower or whatever. Just say, "I know, I understand if you can't participate in this, but I wanted to include you because you're my friend." So,
That was going to be my next question is how do you give somebody permission to not come to your baby shower? Because I know that can be really difficult.
say, "I would love to have you participate if you can, but if you're not in a place where you can handle that right now, I totally understand. And I still love you. And we're here for you when you are willing or when you are ready to celebrate with us." If
Totally.
that ever happens.
Totally. Oh my goodness. This has been such a good conversation. I learned a ton. I cried a ton as well. I think the
Okay.
topic of loss is just, it's hard. It makes me really sad to think about families that have these like open spots in their families of where babies belong. It makes me sad to think about how little support there is for people who are going through such a life-changing experience. And we really just slough it off as just, okay, on to the next one. And it's really not. It's very life-altering. You're a different person after your loss than you were before. And I feel an immense sense of sadness for the people who have experienced that and the lack of support they have gotten for that. So I hope that we're able to change that. I appreciate you and I appreciate all the people who are doing the work. And I really appreciate you being here sharing your story, but also your wisdom and your knowledge and the resources with our families and everyone listening. So, medical professionals, you even helped educate today. Sarah, if people were interested in learning more from you or talking to you, sharing their story with you, hearing your story a little bit more, where can they connect with you and how can they learn from you?
Yeah. My Instagram is at Paldula, so pregnancy after loss, Pal Doula. And I pretty much am not on any other social media platforms. I do have a podcast. It's the Pal Doula podcast. And the goal of that is just to give hope and help for moms going through pregnancy after loss. That's what I specialize in. Then my website is pregnancyafterlossdoula.com. I'm not sure when this episode is coming out, but I do have a workshop coming up about navigating anxiety during pregnancy after loss. And I would love if you wanted to come be part of that workshop. It's going to be so good. So many tools for navigating the anxiety that is specific to pregnancy after loss. So,
Cool. We will link all of that in the show notes for people to find you. Truly, thank you so much for being here today. This has been a very enlightening conversation, and I've really enjoyed my time with you. So thank you so much.
thank you.
Listeners, Oh, no, go ahead. What else?
I was just going to say thank you so much for being willing to go past your own comfort zone and have this conversation, because I think it's so important. And thank you for
Yeah.
having us on.
Yeah, absolutely. Hey, this is not about me. This is about helping people truly have a better experience. And if I have to get a little uncomfortable and a little teary-eyed along the way, then I totally
We
will
can
do
cry
that.
together anytime.
Absolutely. I'm a very emotional person anyway. So if you're a longtime listener, you know I cry often. Sweet things, things that make me angry. I'm a very just passionate person. I cry a lot. This was not abnormal, but yeah, I'm always happy to get uncomfortable. All right, you guys, be sure to connect with Sarah on social media, visit her website, and I'll see you in the next episode. You can find me on Instagram at Tranquility by HeHe or the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.